5:30 to 6 p.m. You can also see the shows on All County Healthcare's Facebook page, which I'm actually sharing to my own page now. Isn't that great? With social media, you can immediately share what you want so all your friends and family can see. And if you're a good multitasker like I'm learning to be, you can actually do it while you're on a radio show. So there, share now with all my friends, and then they can see this anytime. So if they have any questions about endocrinology from tonight's program, it's always going to live there, that show. So that's All County Healthcare's Facebook page and All County Healthcare's website as well, which is allcountyhealthcare.com. If you have any questions about Medicare or home health, you can call Maddie toll free at 1-888-717-7170. There it is, All County Healthcare. They're awesome. And the number's right behind me on the video broadcast too. So like I said, we're going to have Dr. Anna Silva in the studio. She's actually a DO. She's going to talk a little bit about that. That's Doctor of Osteopathic Medicine versus an MD. So Dr. Silva has been practicing since 2010. She's with Tenet Florida Physician Services. She's actually over in Fort Lauderdale on the campus of Florida Medical Center, a campus in North Shore. So that's their pilot hospital, their twin hospital, I should say, of North Shore Medical Center in Miami is where Dr. Silva is on staff at Florida Medical Center, and that's in Fort Lauderdale. Again, her office is right there on the campus. She is board certified in internal medicine, and she went to medical school here in South Florida at Nova Southeastern University College of Osteopathic Medicine in Davie, Florida. Great program at Nova. As you know, we've had a ton of doctors from Nova on the program. We've even had some nurse practitioners and even a doctor in nursing. If you remember, Vivian Carta Sanchez was on the program not too long ago. Dr. Silva did her internship at Palmetto General Hospital in Hialeah, another fantastic hospital. She did her internship there in internal medicine. Her residency also at Palmetto General Hospital in Hialeah in internal medicine, and a fellowship in endocrinology, diabetes, and metabolism at Larkin Community Hospital in South Miami. Wow, she is as South Florida as you get. But on top of all that, she speaks 3 languages: English, Portuguese, and Spanish. So we have a lot of bilingual physicians on the program, so that's English and Spanish. But great thing about Dr. Silva is she speaks Portuguese. And we have a huge Brazilian population in South Florida now. As you know, all of South Florida is kind of a melting pot, but it is great to have a doctor on staff who can speak Portuguese. So that's something I'm really looking forward to in South Florida, because I get asked, a lot of the time, do you have a doctor who speaks Creole? Do you have a doctor who speaks Spanish? And a lot lately, do you have a doctor that speaks Portuguese? So that is fantastic. Dr. Silva came from Bradenton, Florida, where she was a professional at Pinnacle Medical Group, a professional endocrinologist. And like I said, now she's now on board at Tenet Florida Physician Services in Fort Lauderdale. Location of her office, it's really easy. It's on Oakland Park Boulevard, or just off of it. It's 3001 Northwest 49th Avenue, Suite 104. That's at the intersection of Oakland Park Boulevard and 49th Avenue. So that's right there. That's Florida Medical Center right there as well. So we're Dr. Silva is going to join us in just a second, but one of the reasons I wanted to have her on is because an endocrinologist, for that matter, is because it's Diabetes Awareness Month. November is Diabetes Awareness Month. So tonight we're going to find out what is exactly diabetes, what is insulin. We hear that term all the time. What is insulin? Is diabetes on the rise in America? Which I'm going to ask the doctor, but I'm going to bet it is, because as the obesity rises, as those obesity rates rise, so does the statistics for diabetes in America, because it's linked to obesity as well. We're going to ask her a little bit of how's diabetes tested for. Is that the blood or the prick they do in the hospital or medical office where they test the blood for the A1C? Is that the only test available for diabetes? And something that I was doing a little research on that I'm kind of find fascinating, can you be skinny and have diabetes? It's not just a disease that attacks people that are overweight or obese. I mean, it can attack anyone at any body type. So that I kind of find that interesting. I never knew that until I started researching diabetes for this topic. We're going to talk about a little bit, is diabetes more common in people that are overweight? When does a primary care refer patients to an endocrinologist? It's not like you get up in the morning and you say, oh, let me get up this morning and go to my cardiothoracic surgeon, or let me go to my endocrinologist. Let me see what they're up to. It doesn't work like that. I believe your primary care would refer you probably after they did a blood test and saw something that was alarming in the test results. So that's really neat that nowadays that we have a doctor just dedicated to hormone-related diseases. And when I say hormone-related diseases, I'm talking about not only diabetes, prediabetes, which is another form of it, thyroid disorders. You hear a lot of that lately with baby boomers, people that are over 65. A lot of them have to either go in for a thyroid biopsy, which is actually a needle aspiration in the neck that checks the tissue for cancer. Or in some cases, the thyroid needs to be taken out, and then the patient will go to an endocrinologist for the majority of their future, if not all their future, as they're put on medication to replace some of the work that thyroid does, the thyroid that was removed. So Dr. Silva also is an expert in thyroid disorders. And then polycystic ovary syndrome, PCOS, affecting the female population, obviously. I've seen that before. That's on a lot of endocrinologists' areas of interest. So that's something I hope to, have a little time at the end of tonight's interview to ask her about. And, of course, obesity and weight disorders, which we kind of started with. That's something that, endocrinology is tied to with the diabetes. So I have a lot of questions ready for the doctor. And I just want to let everyone know also, she is affiliated with American Association of Clinical Endocrinologists, the Endocrine Society, which is a national organization, the American Osteopathic Association, and the American College of Osteopathic Internists. If you remember in the past, we've had a lot of osteopathic physicians on the program. They have the title DO after their name. So instead of MD, it would say Anna Silva. Well, it does say Anna Silva, DO. And osteopathic physician goes through a little different training. They're very hands-on. They actually, when I mean hands-on, they actually check the organs in a visit. I recently changed my primary care doctor from an MD to a DO, and I found it interesting that my checkup, I laid down on the actual doctor's table there, and he checked all of my organs. He actually pushed on different parts of my organs. He spent a good 2 minutes doing that, so checking to see where the placement was. I'd never had an MD do that, so I find that interesting. It's more hands-on. I think it's a little more holistic of an approach. It's kind of like, in my opinion, where medicine is going. I mean, I never even saw the DO title a few years ago. So I'm definitely going to ask Dr. Silva about that as well. And then we're going to talk a lot about, different blood disorders, hypoglycemia. You've heard that in the news lately. What is the protocol for treating a bout of hyperglycemia? And what can happen if it's left untreated? What is prediabetes as well? Is that something that happens before the diabetes? Is that something that can be kind of controlled by diet? Can it? And if you have diabetes, is it something that you have forever or that you can actually get rid of over time? So I have a lot of questions, and we're going to let the doctor get situated here. Dr. Silva, just take that microphone and put it right there when you're ready. I was just telling the audience, and we just went through your whole resume. You have an amazing resume.
Well, thank you.
Thank you.
13 years of work, right?
Wow, yeah. That's awesome. And you speak Portuguese, which is awesome because we have a huge Brazilian population in South Florida. Humongous.
I was born in Brazil, and I moved here when I was 9.
Oh, wow.
And my mom made it a rule that we weren't allowed to speak English at home. So until this day, she speaks to me in Portuguese.
Wow, good move.
Yes.
That's a very important. You're able to learn the complete language there. But you speak perfect English.
If I'm really tired, I have an accent. So you can always tell when I didn't get a good night's sleep.
Definitely. And you speak Spanish as well?
I do. I trained in Hialeah.
Oh, yeah, that's right. We went through that, Palmetto General Hospital.
Yeah, so I definitely learned how to speak Spanish, and it's very similar to Portuguese, so it made it easy.
Okay. I'm going to blow through the commercial if that's okay, and then we're going to go on with the interview. I'm just going to make sure if that's okay first. Yeah? Are we going to take it? All right, we'll take it, and we'll be right back with Dr. Silva. I'm going to ask a couple of the questions I presented before on the How to Stay Healthy show. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And welcome back. We have Dr. Anna Silva with us. She's an endocrinologist practicing at Florida Medical Center, a campus in North Shore, but has a great office with Tenet Florida Physician Services in Fort Lauderdale. I've seen it pronounced Fort Lauderdale and Lauderdale Lake, so I think it works for both, right, Dr. Silva?
As long as they look for the hospital, they'll find the office.
That's right, and you're in with another endocrinologist there. The office numbers or the address is 3001 Northwest 49th Avenue, Suite 104, Fort Lauderdale. 954-714-0684 is the number, and I'll give that again. Dr. Silva, I wanted to ask you, we hear the term all the time, but I don't know if some of us really know what it is. What is diabetes?
So diabetes is basically just a lump diagnosis for anybody that has a sugar disorder. So if you have elevated blood sugars, we call you a diabetic, but there could be many different reasons for you to be a diabetic, and there are many different classifications of diabetic. So Just so you have an idea, CDC just came out with their statistics. More than 100 million people in the U.S. are living with prediabetes or diabetes. That's pretty significant. And if you think about it, if you do nothing, all of those pre-diabetics will become a diabetic. So
Wow.
100 million people, there are just not enough doctors in the world to treat that. So we really need to do something to help those patients that are in the pre-diabetes phase from becoming a full-blown diabetic.
I see. So it's definitely on the rise in this country then.
Yes.
I mean, it's just going to keep on going up. And why is that reason? Is it because of obesity, or can also the second part of that question I want to throw in there is, can skinny people have diabetes? Like, is it
really good question? So the CDC also has what they do is they post a map of the United States, and they put in a darker shade of blue the areas that have the largest clusters of a diagnosis. So if you pull up obesity in the United States, what they do is they have a table that shows you the last 6 years of maps of obesity, and then right next to it you pull up diabetes. You see that all those areas that had been darker blue obesity a couple of years later start getting darker blue diabetes, meaning what? As the rate of obesity rises, we get a rise also in diabetes.
I see.
However, not every diabetic is due to obesity. You can have diabetes because you are pregnant and you have a hormonal imbalance caused by the placenta and being pregnant, and you become a diabetic. I'm not a heavy set person, and I had gestational diabetes. So it made me very fond of diabetics, and I totally understand when they have complaints about things. But we also have type 1 diabetes, which is a complete different species of diabetes altogether. It's an autoimmune process, which basically means your body got confused and it decided to attack your pancreas, which is the gland that makes insulin. Yeah. And now those patients no longer can make insulin, so they become a diabetic. You can have them as young as a few weeks old that become type 1 diabetic. And the oldest I've ever seen become a type 1 diabetic was in their late 80s.
Oh, wow.
So it can happen anytime.
Now, well, I know gestational diabetes somewhat can be controlled by diet. Can the other types of diabetes as well be controlled by diet? And then if not, the second part kind of is medication an option?
So good question. The type 1 diabetes has to be treated with insulin because they just don't make insulin.
So that's the one that we know about where people give their own insulin shots kind of thing?
Correct.
Okay.
So that one has to be insulin managed. There's not really an option. There's always the exception to the rule. So there are some type 1s, if they're found very early on in the disease process, we call them honeymooners because they still make some insulin in the background. Mm-hmm. And some patients can do that for years at a time, and they need very minimal insulin. They don't need the multiple doses a day, and they do very well. Now, the gestational patients, just like a type 2, can be managed on diet alone. But it really depends on each person. Some patients, when they got diagnosed with diabetes, their pancreas was just so far gone that there's really not much that we can do, and they need to be on insulin, or they can be on medications that they take by mouth.
Wow, it is an amazing disease, and I don't mean that like obviously in a good way, just the whole chemistry of it and the whole way that it works. I mean, you must be extremely smart to be in this field because it is so complex to me.
It is complex, but it's actually really fun. I think one of the pitfalls that a lot of people have is they're just like, oh, this is diabetes, so I want, a plan. Give me, what's the best way? Do I start on that, and then I go to this, and then do I do that? There's not really a best method or route that works for every single person. You really need to tailor it to that person and think about why is it that that person is struggling with their diabetes, what's causing their blood sugars to be elevated. That way you can make their best treatment choices. The only thing that I could say that 99% of the diabetics would benefit from is if they have a good diet and if they're active. Mm-hmm. I don't know I could say maybe a couple of diabetics of mine that I would say they were just too stringent on their diet or extremely overactive and they needed to cut down. But most of the patients, we just tweak some things and they learn things that they didn't know about their food and they do better.
Oh, wow. Now, that A1C blood test that we get, I think mostly as adults, but correct me if I'm wrong. Now, what is that A1C reading? And then the other part of it is someone referred to an endocrinologist, or do they just like call them up and say, hey, I need to see my endocrinologist? How does that work?
Okay, good question. So the way I describe the A1C to the patients, I make it really simple. So sugar's sticky, and if you pretend that your red blood cells are sticky also, what happens is the sugar in your blood would go and stick to those red blood cells. A very cool chemist or lab person can pull up those red blood cells and give a rough estimate of how much sugar is stuck on those red blood cells. And it gives you an average of what your blood sugars have been running for the past 3 months. So that's a really good way for us to see, even if the patient's not checking their blood sugars, what is going on in their body. Are they well controlled or are they poorly controlled?
I heard that is it goes back up to 3 months. I've heard that a few times. So it's not something like the week before the test you can change by drinking a lot of water.
No.
That's always.
We can usually tell when that happens because we'll look at a blood sugar log and we'll say, wow, these blood sugars have been really great the last week. And then we pull up the A1C, we're like, wait a minute, what just happened here? And then the patient laughs, I had a really bad month. And you say, okay, I got you, but...
No, my listeners know that I'm checked for pre-diabetes because of my size. I'm a big guy. I still carry all that weight from playing football. But, yeah, I learned early on that you, from my internist, and I know you're board-certified in internal medicine. That's amazing also. And fellowship trained in endocrinology, metabolism, and I had it right here.
Diabetes. Endocrinology, yes.
Wow, that is unbelievable. That is really neat. That's a very smart doctor we have in the studio, Dr. Anna Silva. But what I was saying was, I tried to see if I could just, hey, doc, if the next 2 weeks, if I really, will I be able to get under those numbers that you want?
You can't cheat the test. That's sorry.
Unbelievable. Why did you decide to become an endocrinologist?
That's a good question. So first you start off doing internal medicine, and my second year, I started noticing that there's just so much that you have to be really good at to be an excellent internist. And I figured I really want to specialize in something, but I didn't know what. And I had a really good mentor at Palmetto, and she was an endocrinologist, and she always looked really happy. So I said, hey, I want to be just like her. So I worked with her closely, and the nice thing about endocrinology is you almost have immediate gratification. The blood sugar's high, you give them insulin, it goes to normal. That doesn't really happen in medicine, so I really like that. And you can really impact people's lives with just a little bit change in education.
We hear that a lot. I mean, it seems like doctors, I've interviewed doctors for about a year now on this show, and you know what it really comes down to is helping the patient with the quality of life. Right. I always see doctors light up when they, like you just said, like your whole face and complexion lit up when you said that. And I think that is just fantastic. It's quality of life. I want to ask you about a couple other things that I think you are able to help people with in the office. Thyroid disorders, that's something we're hearing a lot about. Is that something you do in the office?
Yes, we do manage thyroid also in the office.
Okay, is that, do you do is that a test for cancer? Is that thyroid cancer in the neck area?
So there are many different kinds of thyroid diseases. You can have a hormone imbalance with thyroid where the patient has too much or too little thyroid hormone, and that would be done by a blood test.
Okay.
Or you can have lumps and bumps on your thyroid, which are called nodules, and in some patients, those lumps or bumps can become cancerous.
Oh,
so
wow.
we manage the full spectrum from lumps and bumps to abnormal labs and cancer.
Oh, wow. So there's times that you're diagnosing cancer and then helping them get to the next specialist.
Yes.
Wow. Polycystic ovary syndrome, PCOS. Is that another thing?
PCOS, that's basically diabetes of your ovaries. That's a
Okay.
huge disease component for a lot of ladies.
Really, we don't hear a lot about that.
No, it's kind of
I
like
guess because I'm a guy, I probably wouldn't hear a lot about that. But yeah, definitely, we don't hear a lot about it in the news.
no, it's kind of like a closet diagnosis. Nobody
Huh.
really talks about it, but they really should.
Wow. I definitely want to have you back on the program. We got a lot of your info out early, but I just wanted to give it out one more time. We got a few seconds left. Dr. Anna Silva, endocrinologist, 954-714-0684. Oh, it's up on the screen. You can check this out on YouTube or All County Healthcare's Facebook Live or YouTube's amp2.tv. Put that in there. You can check out the show anytime. And lastly, Dr. Silva, again, her address is 3001 Northwest 49th Avenue, Suite 104, Fort Lauderdale. Dr. Silva, thank you for being on the show. I really appreciate it.
Thank you for having me.
And that's it for How to Stay Healthy. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The